I've had many pneumonias and had several sick times I've been on a vent, so I don't want to have to go back on it. But
Danny Simpson isn't sure his body could handle a COVID-19 infection. He's quadriplegic, requires oxygen, and uses a tube in his throat to breathe. While some other states like Virginia are opening up vaccine appointments for those with underlying health issues, Danny says he's willing to travel, but he can't make a long trip.
we wouldn't mind, somewhere like Martinsville or Danville. That's not a very far trip when we get back. But, if we anywhere else, staying overnight, then you have to stay in a hotel. That's another risk.
It's why he and his wife have written to Governor Roy Cooper, Dr. Mandy Cohen, even President Biden, asking for faster access to the COVID-19 vaccine. The ARC of North Carolina is also sending letters to the state on behalf of those with intellectual and developmental disabilities, too.
We still have folks who have underlying health issues, and just because they're 25 doesn't mean they should be at the end of the line.
Friday, we were able to ask the DHHS secretary why the change in priority was made.
If you look at the deaths in North Carolina, 83% of deaths in North Carolina are from those who are 65 and up. So that is definitely top priority. Then we wanted to look at those who can't stay home.
If we talk about who's the most vulnerable, someone with a trach and on oxygen at night, as well as whenever he's not feeling well. I don't think there's many people who would have a worse outcome to COVID.
Until it's his turn to get vaccinated, Danny says he will continue to quarantine until after frontline workers get their shots.
Well, we can stay home because we're handicapped. Our mental health can always take that.